Just ahead on the UMC Digest, 2 years down the road now, what has changed, what's new, what's coming up next with COVID-19? We'll find out with the expert. That's next right here on the UMC Digest. Welcome to the UMC Digest. I'm Danita Cohen, and we're very happy that you're with us. We're both masked here inside. Dr. Asad joins us. She's our medical director of infectious disease at UMC. Very nice to see you again.
Likewise.
It's always good to talk with you. Things are opening up back in Las Vegas.
Yep.
We have conventions coming to town, all sorts of exciting things. What do you think about all of this?
You know, I'm actually in favor of opening up our cities. In a way, getting on with our lives. 2 years have gone by. You can't put your life on hold forever and ever. What we have to do moving forward is come up with strategies to, in a way, coexist with this virus so that there is minimum interruption to the way we conduct our daily lives, whether it's going back to work, having conventions, kids going to school. We need to learn how to move forward with this pandemic. We cannot put everything on hold while this pandemic is going to go on, because realistically speaking, it might be here for a while, though not necessarily in the severity that we saw in the beginning, but it's definitely going to be around. So I am in support of actually going on with our lives, but that's not to imply that we're not going to focus on strategies to protect everybody from the disease. And the way I see it, that strategy is mainly twofold. One, continue to vaccinate, because that is the safest way to build immunity against this virus, regardless of the variants that are around or new variants that might emerge in the future. And the second part of the strategy should be easy and early access to outpatient safe treatments for COVID to prevent people who do acquire the disease from getting sick enough that they require hospitalization.
So let's go back to vaccine. I have been feeling for some time now that if people have not been vaccinated by now, after all the education, after everything that they've heard, after we've seen hospitals overflowing, after we've talked about what happens when people are critically ill in the ICU and how awful that looks. If they're not vaccinated after that, is there any hope to still get people vaccinated?
So as of now, there are a good 50 million people in the United States who are still unvaccinated despite widespread and very easy access to the vaccine. I honestly still am very hopeful. There are some individuals who are adamantly against vaccination, but the fair amount of people that I come across are not averse to receiving the vaccine. They are still uncertain. They have questions that they need answered. Many of them just want a decent amount of time to make sure or reassure themselves that the folks around them who have been vaccinated are doing okay. So I still have hope that as time goes on and the confidence in the vaccine continues to build, they are reassured by seeing people around them who got the vaccine and are doing fine, they will still come forward and get vaccinated.
What kinds of questions do you hear when you meet with community members? What are they most concerned about or thinking about?
I think one of the first thing in everybody's mind is that this is a brand new vaccine. It was introduced into the market to public before it was thoroughly investigated, thoroughly tested. That is the big concern everybody has. The truth is that even when the vaccine was first introduced and people started getting vaccinated, this technology was not a new one. This was something that the scientists had been working on for decades, albeit with different viruses, because honestly, before 2019, there was no SARS-CoV-2. But this technology with the messenger RNA vaccines had been something they were working on for years on other kinds of viruses. And that was the primary reason why this vaccine was so readily available early on in the pandemic. That is the main thing I hear about. And the second one is concerns that this is an emergency use authorized vaccine now. Well, that for sure has changed. Now, both of the messenger RNA vaccines, which are the first line vaccines recommended by the CDC to prevent COVID-19, are full FDA approved vaccines. So it's not an experimental vaccine anymore either. The other question I hear is concerns about side effects of the vaccine, which is a very valid concern. I have 2 young kids, and I thought twice, despite being in the midst of this and knowing quite a bit about it. I had my concerns. It was easy for me to accept a vaccine for myself, but I gave a lot of thought into it before I vaccinated my 7 and 11-year-olds. But what I did was I read up all the data on the vaccines. I looked at the side effects that were mentioned anywhere. If you're interested in reading about them, a CDC webpage is a very good resource. And then I was reassured by the fact that long before young kids started receiving the vaccine, millions of adults, not just in the United States, but throughout the world, had already received the vaccine with very, very rare side effects. So at this point, there are so many more people who have now received the vaccine, and I think that should be reassuring to individuals. People frequently cite adverse effects that they noticed in a family member. If there's one thing I could stress is avoid those anecdotal reports of a family member or someone. If you have questions about the side effects, talk to a trusted healthcare provider in your community, somebody you know who can give you the exact facts. Those are the main things that I hear about it. Some people are bothered that they are mandated in certain work environments or to get the vaccine. And, I always try to tell my patients that, listen, there are a lot of other vaccines that are also mandated, that you sign off for your kids when they go to schools, colleges, and you never get bothered about that. Just because there is a mandate does not necessarily mean there's something wrong with the vaccine. It's just that scientists believe that the benefits of this vaccine are so impressive and the side effects are so minimal that you really should get it. Those are the big ones that I hear about, but I think understanding the side effects is the big one. Some people are worried that there is something unusual about this technology, like a chip is being inserted into to monitor your activities. Nothing like that. And when we have a chance to sit down and talk, there are very rare patients who actually decline the vaccine. As long as they are open to talking about it, they always come around. It's the one who don't even want to start the conversation are the ones that are difficult to convince.
Some people have said, well, the flu shot always makes me sick, and so therefore I don't want to get the COVID vaccine. What's your response to that?
So when you are told what to expect after you receive a vaccine, then it worries you less, right? So when people are about to get a flu vaccine, I always tell them your arm is going to be sore for 24 hours. You may even feel very tired and achy. You may have a low-grade fever, but that does not mean you got the flu or you got sick or this is a bad effect of the vaccine. This, in fact, is a sign that your body has responded to the vaccine and is building antibodies to fight off any virus in the future. Same with the COVID vaccine. Realistically speaking, when you get the vaccine, you can have similar mild side effects such as soreness of your arm, even a low-grade fever, achiness, and this can last for 24 to 48 hours, but they are mild and they are invariably done in a day or two. And it is only because your body is building antibodies to fight the infection. This is not a sign of disease. This is not a sign that the vaccine has affected you adversely. It is actually a very good sign. Your body is responding to the vaccine and making the antibodies it is supposed to.
And help me understand something else, and then we'll move on from vaccinations. People who have refused to get the vaccine then get COVID and then want to run and get the antibodies.
It's strange, and I've given some thought to this because essentially it's a similar thing, right? You are trying to get antibodies to fight the virus. There are two ways to get that antibody. You either get vaccinated and your body responds by making antibodies to fight off an infection that might happen in the future. With the monoclonal antibodies, since you never got the vaccine and you have absolutely no way to fight off the virus, we infuse artificially prepared antibodies directly into your system. So one is called active immunization, that's your vaccine. The other is passive immunization, where we put ready-made antibodies into you. So why people are averse to vaccination and yet receptive to receiving the monoclonal antibodies? The couple of explanations that come up are that one, it is one thing to refuse a vaccination, perhaps being caught up by the particular group of people you're with, friends, family, or perhaps just resisting something because you were told to do it, because that's also human nature. And then that changes when the reality of the disease strikes you, when you realize that, okay, now I have COVID, now it strikes home, now I'm sick. And at that point, most people don't really care what they are being infused, and they just want that treatment. So that's the main thing. I think when the reality of the disease really hits you hard, that's when you forget about objections that were not really based on any good evidence.
We'll be back in just a minute.
Before the masks, before the distancing, before the world changed, UMC was ready. Our response to COVID-19 began before the crisis did, with our own team of infectious disease experts who've spent their careers planning for this moment. With a pandemic response plan, we'd practiced again and again, and by blazing new trails in large-scale testing, including every patient we admit. Always ready. UMC.
And we're back here on UMC Digest. Dr. Asad joining us to talk about the latest COVID updates. Thank you again for being here. Let's talk about treatments and therapeutics and monoclonal antibodies. At first, we opened up a clinic at UMC and we had a great supply. And then what happened and where are we now?
Okay. So, the path forward for COVID, in my opinion, is to try to focus on providing outpatient treatment early before patients get very sick. That outpatient treatment could be an antiviral medication such as Paxlovid, which is an oral pill that's effective against COVID-19, or it might be a monoclonal antibody infusion. Now, since the beginning of the pandemic, there have been multiple different monoclonal antibodies available. It's important to understand that some of them target the Omicron variant, whereas the others are not capable of covering that. So earlier on in the pandemic, I would say fall of last year, we had multiple options in terms of the monoclonal antibody that could be offered. But somewhere around early December, the variant, not just in Nevada, Las Vegas, but pretty much throughout the country shifted from being predominantly Delta to becoming predominantly Omicron. There is only one monoclonal antibody that is effective against Omicron, and that is sotrovimab. When that shift happened, then all of a sudden, from having a very large supply of monoclonal antibodies provided to us, we were suddenly limited to only one of them. And that obviously put a constraint on the number of patients that we could help at that time. So that was the reason why somewhere around early January, we really had a very limited supply of this particular monoclonal antibody, which is the only one that is effective at this time. And one other thing I did want to clarify is the sotrovimab, which is the current monoclonal antibody that is being recommended for treatment, is effective against all current circulating variants, so Omicron or Delta. So that's primarily the reason why there was a period where we couldn't offer it to that many patients. We simply did not have enough of the medication.
What's your response when and we've heard people questioning, well, the government was holding it back?
Yeah, I don't think the government does not hold it back. It is not in the interest of the government to not treat patients before they get sick and end up in a hospital. The government was not holding back the medication. It is simply one of those things where the supply did not catch up with the demand of the medication at that time.
And Paxlovid, how sick do you have to be with COVID to get that, or should everybody get it?
So
everybody who's positive.
Yeah. The way I like to think of Paxlovid is similar to some of the antivirals that we use to treat influenza, right? The idea is that once you're diagnosed with COVID and you have symptoms, then very soon after that, you receive the Paxlovid. As of now, the way Paxlovid is allowed to be used under the emergency use authorization issued by the FDA is that it should be within 3 to 5 days of the onset of your symptoms. You have to be at least 12 years of age or older and weigh at least 40 kilograms. And at this point, because of a somewhat limited supply, it's restricted to individuals who have some risk factor for severe disease. But those risk factors are actually very simple. So something like a BMI of more than 25. So if you are overweight, you would qualify. If you have high blood pressure, you qualify. If you take medications or your cholesterol numbers are not normal, you would qualify. If you have a history of any kind of heart disease, if you have asthma, you have COPD, and there is a very long list of conditions that you could qualify for Paxlovid. So the key here is early contact. So talk to your healthcare provider. The sooner you get the antiviral, the more effective it is. So when it's given within 3 to 5 days, it is 88 to 89% effective in preventing severe disease and hospitalization.
It seems that the biggest difference between 2 years ago and now is that people who are getting COVID aren't necessarily as sick, right, as they were before. Is that because of the vaccine, or what do you attribute that to?
I think it's actually several things. One is that an ever-increasing population is now getting vaccinated, right? I was looking at some numbers yesterday. I believe in Clark County, well above 55% of the population ages 5 and older are fully vaccinated. And if you take into account any individual who has even initiated that process, it's above 65%. So one thing is increasing immunity amongst the population. The second reason is those who are unvaccinated, many of those have had natural infection. So while it's not the ideal way to confer immunity, it does develop some degree of immunity. And the other thing is the predominant variant, Omicron, as highly contagious as it is, clearly does not cause the same severity of illness that the Delta variant does. But I don't want this to imply that then it's okay to have Omicron because it's not a severe disease. It's not a severe disease unless you have underlying medical conditions that predispose to a poor outcome. So if you have underlying uncontrolled diabetes or heart disease or lung disease, or you're immunocompromised either because of your medical conditions or because of treatments you're receiving for it, even with Omicron, which tends to cause definitely a milder disease than Delta, you can get severely sick and you could require hospitalization.
How many times can people get COVID? What are you seeing? Obviously, we don't know yet, right? But what's the highest number of repeat offenders? And is it different with the different
I've actually
variants?
seen there's plenty that have had at least 2 infections, right? Because the variants right at the beginning of the pandemic are very, very different from the ones that we have now. So yeah, 2. I've seen 2, but I don't think I've seen more than that.
And how quickly or how far apart are those? Like, can you have it and then a month later get it again?
No, because, when you have a bout of COVID, right, even if you were previously not vaccinated, the infection itself does confer, in the majority of people, some degree of immunity. And that immunity, at the minimum, hangs around for at least 3 months. And because of that, we typically do not see a reinfection at least within 3 months of the first infection.
All right. We'll be right back. Stay with us.
There's no time for downtime. Better get better, quick. UMC Quick Care has locations all across the valley, and you never need an appointment. So get in and get better. UMC Quick Care.
You ready?
There's no time for downtime. Better get better, quick. UMC Quick Care has locations all across the valley, and you never need an appointment. So get in and get better. UMC Quick Care.
And we are back on UMC Digest with Dr. Asad, our medical director for infectious disease at UMC. Always nice to spend some time with you. You seem to always lend a lot of clarity to what can get extremely complicated. For folks who are watching, what's the best source of information? Because everywhere you turn, it seems there are different answers.
Yeah. And, that's something that has been a problem from the beginning of this pandemic. There are so many sources of information. Which ones do you actually trust? some of the sources that I regularly visit is one is the cdc.gov, their webpage. It has excellent information, and it doesn't only target healthcare providers, but it has excellent patient information, and it's presented in very clear words. There are excellent infographics and pictures. There are lots of videos over there if you want to watch it. They talk about every topic that you can think about. They discuss quarantine, they discuss isolation, what's the difference between the two. There is excellent information if you need the basics. There is basic information about vaccines if you're one of those individuals who really likes to delve deeply into the science behind it. You will find that information over there, and there are references so that you know where your data and numbers are coming from. It also has pages about the epidemiology of the disease, about the numbers that are currently in the country. It talks a lot about the variants, the different proportions that are found in different parts of the country. So the CDC webpage is probably my number one go-to. Then when I want to look at numbers that are more local, that are specific to Clark County, I also visit the Southern Nevada Health District webpage. When you go to their webpage, in the upper right corner, there is a COVID tab, and you click on that and it takes you to a very good page that has a lot of information about the vaccines, the treatments, resources about where to get vaccinated, and lots of local data divided by zip codes, vaccination status. So that's another excellent resource to look at. The third page that I frequently visit to look at the current situation of the pandemic in terms of numbers, cases, hospitalizations is the Nevada Department of Health and Human Services. That is an excellent webpage if you're looking for current numbers, test positivity rate. All the governor's directives are always posted over there. So that's an excellent third resource. And honestly, these are the three big areas that I first visit before I look at any news from reliable sources, because the news pages tend to become a rabbit hole. You just get lost over there. So I start with these three, and then after that I see what's being talked about in the news from reliable sources. But
testing capability has sort of ebbed and flowed over the last couple months. Around the holidays, the testing capability was very low. Everybody wanted to be tested. What are your thoughts these days on when should we get tested? If we think, I don't know, I don't feel good, I was exposed. What are your thoughts on that? And then following that with when should we quarantine, as you were talking about?
So I do think that if you have symptoms that are concerning for COVID, which pretty much could be anything as simple as a fever or a sore, itchy throat or a cough or just feeling achy, tired. With Omicron, we see a lot of gastrointestinal symptoms like nausea, vomiting, diarrhea. Interestingly, the loss of sense of taste and smell is much less with Omicron as compared to Delta. So if you notice any of those symptoms, you should immediately isolate yourself and look for a way to get tested. Okay. You have two ways to get tested. You could either go to one of the many urgent care facilities that offer testing, or you could actually get one of those home tests that you can do at home. Both of them are equally acceptable. One thing I would advise you to not do is to go to an emergency room to try to get tested, because while your concerns are valid, you don't want to overwhelm an emergency room that's responsible for taking care of people who are actually very sick, COVID or otherwise. So those are two ways to get tested, but the key is that if you have symptoms that are concerning, you should isolate yourself from others to prevent the spread of this infection. Let's say the test is positive, then you have to isolate. So the main difference between the word isolation and quarantine is isolation means that you are diagnosed with COVID and you have to stay away from others for a certain period of time to prevent spread of disease. Quarantine means that you have not been diagnosed with COVID, but you were exposed to somebody with COVID and you want to prevent the spread of disease until you have confirmed that you either don't have it or that period of quarantine is over. So quarantine is for people exposed to COVID but not with confirmed COVID, and the word isolation is used for people who have confirmed COVID infection. Now, There have been a lot of recent changes in the duration of isolation that is needed after you're diagnosed with COVID-19. For the general public, regardless of the vaccination status, it is about 5 days from the date of onset of your symptoms, not from the date you got the test done, because sometimes that can take a day or two, but from the day your symptoms started, you need to isolate for 5 days. And even after those 5 days are over, you may not need to remain in your room, in your house, but even when you're out and about with families, friend, or public for the next 5 days, you still need to be very careful about always wearing a well-fitted mask. Okay? And the rationale for these duration comes from the average time an infected individual sheds the virus in his or her secretions and hence can spread it to others. And that average time for the vast majority of people is just about the first week after the onset of symptoms. So you get diagnosed with COVID, you remain in strict isolation for 5 days from the date of the start of your symptoms. After that, you don't have to remain in your house, in your room, but whenever you're out and about, you definitely need for the next 5 days a well-fitted mask.
What are your thoughts on masks these days? We talked at the beginning of the show about Vegas is opening up, conventions coming to town, there's all kinds of shows and sporting events to go to. What are your thoughts on masks at all those events?
I don't think that a lot of frustration about the discussion surrounding the masks comes from the fact that people want definite endpoints at which they can take their masks off. They want an end game over here. They want to know. I think we really need to change the way we think about masks, right? Think of it as an umbrella. Okay, so when you have a mild drizzle outside, you're perfectly okay with just maybe putting an overcoat on or a raincoat on. But if you're in the middle of a downpour, you definitely also want your umbrella up as yet. I think of masks exactly the same way. To me, there is no deadline as to when I have to start wearing it, when I can absolutely stop. For most intelligent, well-read, informed people, I would say use common sense. Look at the disease activity in your community. When that disease activity goes high, even if you are vaccinated, it would make sense to look for an added layer of protection. And that added layer of protection is a mask. It's just as simple as that. To me, it's not a restrictive thing. It's actually something that allows us to keep going on with our regular lives. I would hate the idea of shutting a city down, to stop having conventions, to stop being able to go out. I'd much rather wear a mask if there is increased activity in the community and go on with my life. So I think we need to become more flexible when it comes to using a mask. This is not something restrictive. This is something ultimately intended to give you more freedom.
Thank you for spending some time with us. I know you're very busy back at the hospital, but don't you feel like you have clarity now after you talked to Dr. Asad? I love spending time with you.
Oh,
Thank you.
You're welcome.
Thank you very much.
Thank you so much.
Thank you for joining us. We hope to see you next time right here on Clark County Television. For more information on UMC, our testing centers, and our vaccine centers, please log on to our website, umcsn.com. Thanks again and take care of yourself.